You know, we've all seen those dramatic scenes in the movies. The constant beeping of machines, doctors rushing around, the quiet, tense whispers in the ICU. But what's the real story going on behind those doors? Well, today we're not just looking at a place. We're going to explore the entire journey of critical care. And it's a journey that starts way before a patient even sees the inside of an ICU. And it keeps going long after they've gone home. So let's pull back the curtain and really get to the heart of what it means to be at that critical moment.
So, I want you to picture this. A patient is on a regular hospital ward. They're recovering, everything seems to be going okay. But then, the signs start. They're subtle at first. Maybe their breathing gets a little faster, blood pressure dips just a bit. To you or me, it might not look like much. But to a nurse, that's a quiet alarm bell starting to ring. So, when that quiet bell suddenly becomes a full-blown siren, who answers that call? That single question is where our whole story begins.
You see, the first part of this whole journey, and you could argue it's the most important, is all about prevention. It's about seeing the crisis coming before it even has a chance to explode. And this is where modern medicine has gotten really, really smart, creating these incredible systems to predict danger before it strikes.
What we're really talking about here is something called patient deterioration. And this isn't just a patient having a bad day. Think of it more like a silent landslide. It's that moment when a patient's body, which has been fighting so hard to stay stable, just starts to lose its grip. And now, the clock is ticking. Every single second counts to stop that fall. Now, thankfully, this isn't some guessing game. Hospitals have these amazing systems called track and trigger. Honestly, the best way to think about it is like a smoke detector, but for the human body. It's always on, always monitoring, and the second it picks up the slightest hint of trouble, it sounds the alarm. And that alarm triggers an immediate expert response.
So how does this smoke detector actually work? Well, one of the key tools is something called NEWS2, which stands for the National Early Warning Score. And this is just fascinating. It takes all this complicated data, heart rate, oxygen levels, temperature, breathing, and it boils it all down to one single powerful number. It's a way to cut through the noise and say, with total clarity, this is exactly how sick this person is right now.
And this is the number that changes absolutely everything. A NEWS2 score of 7 or higher. That is not just a number on a chart. That is a siren. That is the signal that flashes across the entire hospital, a clear message that says, this patient is in critical danger. We need to act now. It's the trigger that unleashes the hospital's entire emergency response.
Okay, so the alarm has been triggered, the score is high, what happens next? The cavalry arrives. But this isn't just any doctor or any nurse showing up. We're talking about a highly specialized team, the best of the best, and they are rushing directly to that patient's bedside.
The call goes out, and a critical care outreach practitioner who leads the rapid response team is on their way. These are ICU experts who, quite literally, bring the intensive care unit to the patient wherever they are in the hospital. They are the bridge between a regular ward and the ICU, armed with all the knowledge and skills needed for the most critical situations. And their job is so much more than just giving out medicine. They're like medical detectives, piecing together all the clues to figure out exactly what's going wrong. But maybe most importantly, they are that patient's advocate. They're their champion. They are their voice when they're too sick or too weak to speak for themselves.
Their entire approach is summed up in this one acronym: PREPARE. And just look at how comprehensive this is. It's not just about that immediate crisis, the patient trace and trigger, and the rapid response. It covers the entire system of care: education, patient safety, auditing, and they're even thinking about rehabilitation from day one. This is what's so game-changing. It's not just about putting out fires, it's about building a completely fireproof system. Okay, so what if the rapid response team can't stabilize the patient right there on the ward? Well, that's when the journey takes its next big turn. We are now entering the inner sanctum of the hospital, the intensive care unit. And this is a world of constant vigilance, where incredible technology and human expertise work together minute by minute to pull a patient back from the brink. The second a patient arrives in the ICU, the first thing a critical care nurse does is a systematic ABCDE assessment: airway, breathing, circulation, disability, exposure. Think of it like a pilot's pre-flight checklist. It's this methodical, head-to-toe examination that makes sure that absolutely nothing is missed. It is the foundation that all other care is built on. And that assessment, it's just the first step in what you could call a relentless dance. Life in the ICU is a constant loop. You assess, you plan, you act, you evaluate, and you start all over again. It is a cycle that repeats itself hour after hour, 24/7, with zero room for error.
The whole rhythm of the ICU is just one of perpetual motion and unwavering focus.
And to keep up this incredible level of care, nurses have an entire arsenal of technology at their fingertips. We're talking continuous heart monitoring that never, ever blinks, arterial lines that give a real-time, beat-by-beat story of a patient's blood pressure, and tons of other monitors that are basically a window into the inner workings of the human body. Every single drop of fluid is tracked, and a fully stocked resuscitation trolley is always within arm's reach. It's like a symphony of technology, all orchestrated to save one life.
They also use incredibly powerful medications to support the body when it's failing. This table just shows a few of them. So drugs like noradrenaline and metorominol, they're called vasopressors. The easiest way to think about them is that they tighten up the body's plumbing. They constrict the blood vessels to raise dangerously low blood pressure. And that makes sure that vital organs like the brain and the kidneys keep getting the blood they need to survive, especially during something as devastating as septic shock.
But for all the amazing technology and all the powerful medicines, the real heart of critical care isn't a machine. It's a human being. And that means everyone involved has to confront some of the most profound and difficult questions you can imagine in healthcare.
And that brings us to a question that, frankly, every family hopes they never, ever have to face. Sometimes, despite all the heroic efforts of the medical team, a patient's body just can't recover. And so, the question has to be asked, at what point does trying to find a cure become more of a burden than a blessing?
This is where conversations about things like a DNR or do not resuscitate order happen, and it's so important to understand this isn't a decision that's made lightly or in a vacuum. It is a formal, documented medical order that only happens after a deep, private, and compassionate discussion between senior doctors, the patient, and their family. It's all about honoring what the patient wants and making sure their final journey is one of peace and dignity.
And speaking of honoring the patient's voice, there have been some incredibly positive changes in recent years. The focus is really shifting to empower patients and their families to make sure they're not just passively receiving care, but that they are active partners in the entire process.
Two really powerful examples are Martha's Rule, which was just brought in this year, in 2024, and the Call for Concern initiative. Martha's Rule gives families the explicit right to ask for an urgent second opinion from the critical care team if they feel like they're not being heard. Call for Concern does something similar, giving them a direct line to that same team. Look, these aren't just policies, they're lifelines. They're a recognition that sometimes a family's intuition is the most sensitive medical instrument in the entire room.
So let's say our patient has made it. They've weathered the storm. They're stable, they've pulled through, and they are finally leaving the ICU. You might think the battle is won, but the war is far from over. Because surviving a critical illness is one thing. Learning how to live again, that is a whole other mountain to climb.
Patients who leave the ICU often say they feel like strangers in their own bodies. They face a huge number of challenges. Physically, they can be just profoundly weak, where every single movement is an effort. But it's often the invisible wounds that are the deepest. Many are haunted by PTSD, by anxiety and depression, the trauma, the gaps in their memory, the feeling of lost time. It can be a disorienting and frankly terrifying new reality.
That's why recovery is truly a team sport. Specialized rehab programs are absolutely vital. The unwavering support of family is essential. And one of the most powerful and, I think, beautiful tools is the patient diary. This is where nurses and family members write down the little moments of each day, and it helps create a bridge across that chasm of lost memory. It's a way for patients to reclaim their own story, to understand their journey, and to feel the love that was surrounding them even when they weren't aware of it.
And that really brings us to our final thought here. The science of critical care, it's a modern miracle. It's a testament to our incredible ability to mend a broken body. But as we've seen, this journey doesn't just end with a stable heartbeat. It raises a much bigger question, one that I think should stick with all of us. In a world of such amazing medical technology, how do we make sure that we're not just saving lives, but that we're also healing the human spirit that lives inside them?